What do you think of chiropractors? Are they just a bunch of quacks? That's what we're here to talk about a little bit today and explain a little bit more and give our opinion on what we think. Because guess what? We technically are chiropractors. No, so crazy. Alongside me is Dr. Maddison McBurnie. She's an associate doc at Spine and Sport Rehabilitation Institute. She's one of my right-hand girls. So we're going to laugh, we're going to talk, and we might give you a little something you're not expecting.
Hello, hello. Thanks for having me on today.
I'm so glad you're here and we can just chat. It's so weird to not be like treating each other or
I
something.
know,
I
multitasking,
know.
getting it all done.
I know. We don't, it's in between patients today, so we do not have any wine. And it's too late in the day to have coffee because we would not sleep all night.
Correct.
Correct. But as you know, on the show, we're usually drinking caffeine or some alcohol. And it's just, this is the exception. Patients come first, our license come first, all the things.
Very true. Very true.
So I'm dying to know what Dr. Maddison McBurnie thinks of chiropractic. Like, do you like it?
Yes and no. Mostly no nowadays, if I'm being entirely honest.
No. We are chiropractors. Can you explain a little more?
Yeah, absolutely. So obviously, I have to like it a little if I do it for a living and to go through all of that school and get licensed and take boards. Like, you have to enjoy what you do. So I won't want to say that, yes, I do enjoy what I do. I love what I do. But I think traditional chiropractic and what most people think of as chiropractic, I'm not such a huge fan of. I just think that there's a lot to be left to be desired there. And I think that there's a lot of missing pieces. But our brand of chiropractic and what we do, I think is fabulous. And I think it takes a little bit of education and explaining to most people kind of how we function.
Yeah. No, I feel like that's true. Because a lot of people in the experience of, building this, they're like, what kind of doctor are you? And they forget just because we do things a little different. We have our own brand, our own spice, our own grill on it. So pretend I'm one of those patients and you meet me out and someone, hey, I heard about you guys, but your chiropractor's like, I go get an adjustment. What's different?
Right. So a lot of people ask me exactly that. What's different about what you do? And first thing I tell them is, well, we spend a lot of time with you.
True that. True that.
I feel like I know my patients very well because I'm spending at least 30 minutes with you per appointment, if not longer, if you've got something really crazy going on. And if you are a performance care patient, then I'm seeing you consistently, not every week, not every day, but we're still regular fixtures in each other's lives. So the first thing would be like, I'm not high, rack, crack, bye. It's very much so we're checking in on your function. We're checking in on how you're performing, whether that's just daily life, being a mom, juggling kids and carpool and all those things, or being an elite athlete. How's practice feeling? How is like this one move feeling? Like getting down into the nitty gritty. I'm so not only interested in your pain, but also how are you functioning? How are you feeling in your body and then on the field or wherever else you're at? So I think first it's before I even lay hands on you, we're different because we ask different questions and we spend time talking to people.
So when I'm looking for somewhere else to go and I don't do a virtual appointment with us or come see us in Nashville, what are some things that you advise people to look for?
Are they taking x-rays of you before they even see you? And
Oh, without any red flags.
without any red flags. There is a time and a place for x-rays. We have ordered many of x-ray in our careers. I think it's a great tool. I love that we have rights to write orders for x-rays because it's truly so helpful whenever there's those cases that something's going on and you need to take a closer look. But if you are scheduled to take x-rays before a doctor even looks at you, let alone touches you, it's a red flag for me. It's a no for me. And that's part of what I don't like about chiropractic because it's still taught so heavily in a lot of chiropractic institutions and even a lot of offices around here, still do it. And everywhere, not.
No, that's okay. So that's number one. Give me a second.
If they are signing you up for a treatment care plan before they've explained to you what that care plan is, Don't get me wrong, I definitely lay out a treatment plan to patients, and I tell them, "This is how many visits you can typically expect." Might be more,
Give or take. Yep.
it might be less. It depends on your rate of healing and how compliant you are with your home exercises, all of those things. But I kinda tell you, this is what our game plan is for today, but also for the next however many visits. And typically, granted, there's some exceptions. We only schedule a visit out at a time because things can change and life can change. But also, I'm not, you need to come in 3 times a week for the next 80 weeks of your life in order to get that. Again, that doesn't mean I still see people for performance care
right.
and regularly. It's just more of, before we say that you absolutely have to do these things, I don't know. Well, maybe other chiropractors do, and maybe that's what.
Yeah, but you're missing out here.
I don't know.
Oh
They
my
didn't
gosh.
give me that in my doctor's
Me
note.
neither. I went to school. Everyone will magically appear tomorrow.
Maybe- which, you know,
Okay. Is the full moon tonight? We should look
I
at it.
don't know. I don't know.
No, that's such great information. And I think the time difference is what a lot of people are like, oh my gosh, I spent more time with you. And I feel like I wasn't spending that time. I don't know how I'd figure it out. What do you think?
Oh, I feel like would be so many things that I would miss, and not because I wouldn't have the tools to figure it out, but because how can you know anything about somebody just by sitting
Mm-hmm.
with them?
And
Whether you're a doctor or a human, like on the street, like you don't know anything about it. How do you have enough time to ask about family history, surgical history, injuries, sport injuries, their hobbies, if they're a runner, like what's your mileage like, all of these things. Like there's just not enough time if you're only spending 5 minutes, 10 minutes with someone the first time you meet them to figure out what all's contributing.
absolutely. Like it's important to talk about your whole lifestyle. And I think not only chiropractic, I think this is the medical system, like what we're missing a big part of and what people are craving. And that's what actually will get to the root cause of pain, which is kind of one of our slogans here. Like we want to get to the root cause of what's going on. And sometimes it's not even what you think. Like, can you think of a case even recently that someone came in with a pain or complaint somewhere and it was completely different than where they thought that it was originating?
Yeah, absolutely. And uh, I've seen multiple cases of plantar fasciitis, not fasciitis. A spoiler alert, if it's in both feet and it's been there for over a year, not plantar fasciitis, just by definition, but they will respond to like home exercise or movement before they respond to anything else. And then they look at me like, I'm so frustrated. I've gotten so many injections in my foot. I've considered surgery. And now you're telling me that I could have done this one simple exercise. And like, I'm the most pain free I've been in years. And it's kind of equal parts fulfilling and equal parts, you feel for them. That's frustrating to be chasing pain, but we don't chase. And I have to have that conversation every time of, I know this makes no sense that I'm not even like really addressing your foot right now. I promise I haven't forgotten about it, but I don't think that's what's going on. So that is like, and there's too many cases where fasciitis, but also like a lot of like hip pain in runners or other types of athletes. It's usually not. They might have a labeled, but is that the pain generator? And I think sometimes we don't differentiate just because you have pathology, a rotator cuff tear, a labral tear in your hip, doesn't necessarily mean finger pain.
Absolutely. I feel like two other things that we've seen a lot as a team in the office recently are low back pain, but the origin is like pelvic floor dysfunction.
Yep.
And two, this is always piggyback on what she said, 100% right. This is also with Dr. Martin, and her have all seen. And then shoulder pain, even though there is pathology like the rotator cuff tear and everything, but the actual pain that they're experiencing is in their neck. So we had one person where they went and got the surgery, the rotator cuff surgery, did all the rehab. They were great, but the pain wasn't gone. And that they came back in. They're like, we did all this. We did PT. It's still there when they found us after all that. And it was coming from their neck, which once again, it crushes you, but then it excites you because you're like, we can actually fix this. You don't have to live in pain. And that's just a whole component too that I think I'd like you to speak more on of how you handle this. We look at, you were saying we need to learn your lifestyle. That's also like how much stress is in your life, because it all works together, stress, pain. And how do you see that come out sometimes in people?
So a lot of times you ask about, well, how are you sleeping and how are you recovering if you're, working out or running or your sport is your job. I ask kind of those, hate to use leading questions, but
Mhm.
leading questions. And then, well, stress. Well, just the normal. Okay, but is your normal amount of stress like you are going a mile a minute all the time and you find yourself sighing a lot and like can't take a deep breath? Whereas your normal amount of stress of, yeah, I got a few things going on, but I'm sleeping 8 to 10 hours a night, feeling well rested and all of those things. And so a lot of times I'll tell people like, well, your stress, can impact your pain and your brain can. And that's not to say that your pain's in like all of it's all in your head, but there's so much neurology and science that goes
Mhm.
into how our pain receptors receive those nerve messages of
Mhm.
if you have a nervous system that's cranked on because you're constant under stress, cortisol levels are through the roof, you are going to perceive pain completely differently than somebody that is at a Zen retreat 6 months out of the year, not a care in the world.
Yeah.
It's just
Mhm.
that's science.
Oh, yeah. Very much so. And then on top of that is, what are you putting in your mouth? It's
Yeah.
affecting your gut, that therefore affects your pain. I mean, if you're constipated and you're not pooping every day, that can be part of your back pain. I
Oh,
mean, that's something we also ask you very uncomfortable questions that people look at us and they're like, no doctor's ever asked me that. And I get it. It's like really uncomfortable. I mean, my slogan's breathing out of your butthole here at the office. And so, yeah, we're going to get down and dirty figuring some of this stuff out for you. And have you had any like experiences or things that come to mind when you're like asking a couple of those questions, and what were they?
so I mean, I get nosy, especially because like pelvic floor and
Mm-hmm.
women's health are like two passions.
Mm-hmm.
And so I will ask you all of the deep, dark, like, oh yeah, like tell me about your sex life and
Mm-hmm.
like tell me about like your poop
Mm-hmm.
and tell me about like this and that and the other. And so I'll have people be like, oh yeah, like, yeah, I poop every 6 days, but it's fine. I just take X-Lax every day and I still only poop every 6 days. And then we'll do something like start, okay, I know you have back pain, but we're going to start like the pelvic floor therapy too, which is like non-invasive and it's very easy.
Mm-hmm.
Like you can do it all the time.
Mm-hmm.
And they're like, yeah, my back feels like pretty good, but also like I poop every day now. And so it's one of those things of like, it's not just about your pain, it is about your function.
Mm-hmm.
Because pain, that pain journey, I mean, you talk about this all the time, like it's it's a journey, so it goes up and down.
Mm-hmm.
But if your function is continuing to improve, that is such a great way to judge your progress and
Mm-hmm.
to measure that progress. And I think sometimes we get so hung up on, well, I'm still in pain, not realizing that like yeah, your quality of life is improving. And that's not to say we don't care about your
Mm-hmm.
pain, but like, let's not just only miss out on all these other ways that you can see it progress.
Mm-hmm. Mic drop right there, girl. Mhm. So another question I feel like we get out in the world a lot,
The wild.
wild, crazy world. Yeah. Is okay. Well, you're chiropractor. You only treat pain. So give me an example of something you treated or something people want it, or both. Something you've treated and then something you want to expect that we've had great success and been able to help people with.
Yeah, for sure. So, I mean, I feel like, and I just want to like disclaimer this that there's a lot of chiropractors. They treat all kinds of stuff and it's just really
You
outside there.
cheat stuff.
Outside scope. Like, there is a lot that what we do can help with,
Mm-hmm.
but, like, we can't cure cancer. I
No.
wish we could. I so badly wish we could, but,
Mm-hmm.
like, adjustments just don't do that. So there is a lot that we treat outside of back and neck,
Mm-hmm.
from extremities, wrists, and ankle, elbow, whatever, to pelvic floor, to migraine and headache management, to helping with stress relief.
Mm-hmm.
All of those things, I think most people are surprised we do deal with pelvic floor things
Mm-hmm.
because we don't do internal exams
Mm-hmm.
and we aren't pelvic floor therapists, but we are conservative management providers and practitioners. And so we are able to be that gateway of, you know what, let's start broad and let's see what we can, I tell people, let's see what we can shake out. And if you fail a conservative management childcare, then we've got network of providers of people that we've talked to, that we know, that have treated us, that we've sent families to, that we trust. We got your, even if it's not with us, yeah, we're still going to get you the person who can help you. But like, let's start small with something so like minimally invasive, low risk that like helps. Awesome around. And if not, that's okay. We got your next step, like locked and loaded.
Doesn't this just sound wonderful? You're sitting here right now like, oh my God, this is crazy. Guess what? We offer virtual visits. You can work with Dr. Maddie right now. You just go online. We'll drop the link in the show notes and you can schedule online because we want to be a part of your team. And yeah, that might be virtually, but we'll be able to help you shake it out. What's that Taylor Swift song?
Shake it out. Shake it out. I don't know.
But
We're obviously not huge
yeah.
Swifties.
Yeah. But that just came to my head. But we'll help you figure it out and even get you to someone in your area you need as a part of the team. Like, we know what we have is a special brand and we would love for you to be a part of it. So if you want to pause this and grab that link and schedule now, please do it. But next question for you that we get a lot. Okay. And this, I think people think it's just our like professional athletes that do this. And I want you to debunk that myth a little bit. But I'm not in pain. I don't think I need to see a chiropractor. I feel fine. I mean, I get a little stiff here and there, but I'm much good. Like, why would I want or need to see someone like you guys?
So we call it performance care because it really is all about your performance. And I feel like maintenance care is what traditional chiropractic calls. And it's like, why would you just want to why wouldn't you want to get better?
Oh, gives me goosebumps every time we talk about it.
I feel like, and that's what I tell people too, is like, we're so stubborn. Like, that is an on brand for us. It's like, we are very stubborn and I'm not going to settle for good enough. Like, why should you? I'm not going to settle for good enough for you. We got skin in the game now. So I tell people that like performance care, it varies from person to person. What do you need to feel your absolute best, to be firing on all cylinders, to feel like your function is continuing to improve? For some people, that is once a week. For some people, it's once a month. For some people, it's weeks. For some people, it's twice a month. It just depends on your body. And that is, again, on brand for us, is it's tailor-made to you. So we don't give a one-size fits all. And sometimes it takes a little trial and error. You know, I usually say, hey, like, let's try a couple of weeks. A couple of weeks feels too long. We can always bump it up. A couple of weeks feels great. And you want to try further, like, cool too. Whether you are athlete or you are someone that I want to run a couple miles a week and I want to feel good before and I want to feel good after. And sometimes I feel a little stiff or achy or sore afterwards. Well, let's make sure that we're continuing to build your toolbox and equip you to where if you want to go from, I want to run a mile every so often to I'm going to run regularly, like you can make that transition seamlessly and without or risk of injury. Same thing for like tons of postpartum moms come in and do maintenance care because as your child is developing, like your demands as a mom change too. Your child at 3 months has a whole different set of needs than your child and your role changes too. You go a lot less of breastfeeding, bent over a crib all the time to chasing them around. And so your life isn't static most of the time. So why should your care?
No, 100%. And you men out there, guess what? Drop the mic.
You have a pelvic floor too. That's what I thought you were going with, but I was like,
I know.
yes, you do have a pelvic floor too. And I know, just going to say something kind of shocking. A lot of times, like erectile dysfunction is not just because of like testosterone. It's also like a pelvic floor issue. So like you can pump yourself full of as much Viagra and testosterone pills or whatever that you want, but until you address your pelvic floor, it might not get better. And
possibly your low back.
Yes, especially like, and that's the thing too, is that I treat a ton of golfers and we work on their pelvic floor without them really even knowing like just through a variety of exercises that help them to stabilize their actual core, not their abs, that help them to differentiate their hips. And they're like, yeah, my golf game is great now and my back does weird. It's because we're treating your pelvic floor. And I think a lot of guys are like, well, I don't have a pelvic floor, or that doesn't affect me because I don't have kids. Like I didn't give birth to kids, but it affects so much more than just like postpartum females.
Mm-hmm. And isn't your butthole part of your pelvic floor?
Yeah. And so is your prostate.
And everyone has a butthole.
That's true. That's true.
See? This is what we're working with here. So I got to be honest. I'm always honest with people, whether we're working together in the office, whether you're a patient, whether you're my friend, whether you're my husband, whether you're my dog. I try to keep it real because I want people to keep it real with me. We recorded this before, and on brand to me, as you know, this has happened multiple times, it didn't record. But let me tell you, there's a reason it didn't record, or that I was being blonde or whatever, technically difficult. Thanks to DJ's Houndstooth for helping me out here. But this is even way deeper and way better than what we first got to. And I know there'll probably be a part 2 and possibly a part 3 down the road. But I mean, we're already getting into some good stuff that you guys can walk away from with a ton of information. And I'm really excited about that. In the last one, you gave 2 recommendations of things that I'm, all right, Dr. Maddie, you had to recommend 2 things just to everyone that doesn't even have to do with us. What are some things as a doctor that you recommend?
So I know I feel like I've got 15 different things.
Well, we can add on. We'll do the original 2.
One is your sleep.
Mm-hmm.
If you sleep like shit, you're going to feel like shit.
Yep.
And I don't mean like, oh, I'm getting 8 hours, but I'm like falling asleep with the TV on and I'm having caffeine at 7 p.m. and all these things. Like if your sleep hygiene is out of whack, you cannot expect it.
Mm-hmm.
And so it doesn't have to be like revolutionized overnight, but like making slow steps to getting restful restorative. Don't worry about the type of pillow you need or the mattress or anything like that, but just more so like focus on, how am I sleeping? Like, are all the lights on? Do I have blue light? Am I sleeping restfully? Am I waking up? Am I peeing every 2 hours? Like, those things impact our sleep, which impacts how our mood is, how our pain is, how we eat, our glucose levels, like food sensitivities. All of these things are impacted. Sleep is how we heal. So if you're getting poor sleep, it's like fighting an uphill battle with whatever changes you're making your.
Yeah. No, you have to. It's when your body heals. I know everyone says like, oh, I can function on very little sleep. Sure, but it's going to come bite you in the ass at some point, whether it's pain, whether it's even worse down the road, some serious illness. Studies, you can Google it even. It's out there. The proof's in the pudding, and sleep needs to be taken care of.
Yeah, for
now,
sure.
Drum roll. Number 2.
Breathe into your butthole. Sincerely, like we talk about it all so much. It is like your tagline that everybody knows you for. But honestly, like take time to breathe. And I don't just mean shrug your shoulders up, big, deep chest breath. I mean like put down your phone for a second, stop doing the 50 million things that you need to do and just like be still, be quiet, stop trying to distract yourself and like take a nice, big, deep belly breath. Stop clenching your butt cheek, breathe into your butthole, like do the things and just like check in with your nervous system, check in with yourself of like, am I in pain? Like, where is it? And that gives you good information. And then it gives us good information too. There's so many people that I ask them like, tell me about your pain. And they're like, I don't really know how to describe it. And it's because you've just been distracting yourself and going and doing it. And I get it. Life is busy. We've all been there. So much to do. Yeah. But like truly just like start with just 2 minutes, like being still and breathing and see like how that changes things. Like you might feel calmer. You might feel like more on top of things. You might just feel like, oh my goodness, like I'm running on E and I need to like pour back into my own cup. Like, how are you going to know that if you're moving and putting?
No. I mean, I don't even need to say it. She said it for me. Okay.
I stole your tagline.
No. Let's go. It's an office tagline. And 3,
Oh, I don't remember what I said in the original one. Sorry.
No, that was good. Oh, that's been it. It was something about investing.
Oh, yes. Invest. Spend money on your health. I am one that I've recently learned that like I won't spend money on silly thing. Like I will wear the same pair of shoes for years until they fall apart. And I never thought I would be that person, but I will like spend money on massages or mobility stuff or whatever I need because he's got one body. They don't do like brain transplants and put you in a new body just quite yet. And it is better to maintain and invest in your body now than whenever it falls apart. Preventative care is really honestly the best thing that you can do. And it's worth the investment up front. I know that sometimes we look at, well, that's a lot of money. Well, do you know what else is a lot of money? Like being in a nursing home and like having someone that needs care of you or like all of these other things that could happen. It is way cheaper on the front end or I guess on the back end in hindsight to invest now and then see it pay off in your longevity than for you to put it on the back burner. Oh, that's too much money. And I get it. Like some things do cost a premium, but you have to look like that return.
Right.
Is your quality of life going to improve?
How are you performing at work? How are you able to be there at home? Are you able
Yes.
to be there for your friends? Be there for yourself? Most importantly, it is, okay, your return on your investment, you might not notice until someone says, okay, well, let's talk about your quality of life. And
Right.
being that present, that's, I think, priceless.
Well, and I also think it's like, yes, it's an investment in money, but also it's an investment in time. And I get it that time has to come from somewhere else. We don't just have like limitless to spend on all these things. But like, again, do you know what else takes time? Like taking recovery from surgery or taking sick days or all of these other things. Like that also. So you have to pick like, what are you going to spend? What are you going to spend your money on? Money on medicine or surgery or all these other things to help you get well? Or are you going to spend money and time on things to stay well and improve?
Yeah. Oh, I think that's perfect. And at the office every week, we have meetings with all of us. And I said earlier, it's one of my favorite things about the office. We like to be uncomfortable and push each other to that uncomfortable spot because that's where you grow the most is when you are a little uncomfortable. So we are constantly doing training, working on each other. So yes, we do get worked on from each other. Thank God. When I was solo, oh man, that was terrible. I was not taking care of myself at all. But I want to know what else besides that every week are you doing the people want to know for yourself?
So as far as like for myself as a doctor,
Ooh, both. Let's go.
so start with well, myself as a doctor, I am so whether it is research article or book or just like a case study, something I'm trying to get my eyes at least once a week on something new or a refresher. Little notebook that's almost full now that I've just made notes about. Oh, this is an excerpt from a book I read, or this is from my preceptor from years ago, that X, Y, and Z, and I'm going back through of like, okay, yeah, those are those orthopedic tests. Okay, yeah, that's right, that indicates that, and just making sure like I'm on, staying sharp because I don't see shoulders every day. I don't see, this one thing every day. Each day is something new in the
Which is
office.
fun.
So I like things and like sometimes I'll get into a little rabbit hole of like, I'm only going to read about public. I'm only going to read about running. And it just kind of, it keeps you excited.
Yeah. And that's part of the fun. Every meeting, we're like kind of talking about some of that stuff. And that's kind of an expectation here at the office. You set aside time. You set aside time every week to learn. And then we all review it together. So then we all learn and push each other. Okay. What else are you doing?
So that's one of the things. And then also as the doctor is like, I talk to my peers and my mentors. I ask you questions, or
Mm-hmm.
hey, I did X, Y, and Z. What else could I have done?
Mm-hmm.
What else? What else would you have done? Would you
Mm-hmm.
have done anything different? Or hearing about
Hairball. Hayward's in here.
hearing about like other people's like cases in the office of like, oh, like I don't know if I would have taken that approach. Or
Mhm.
like, yeah, that's exactly what I would have done.
Mm-hmm.
It's just really cool. Or even other non-chiropractors.
Yeah. Yep.
It's cool to hear about their take on things and their
Absolutely. And it just helps us better be able to all work together. 'Cause at our office, even we have a bunch of different specialties that are in here, and we love to all bounce ideas off each other.
Yeah.
So, as a person, and for Maddie herself, what are you doing?
dog pedals. Gently.
The best.
Yeah. We don't deserve dogs, but definitely hanging out with. It's just good. people.
Oh.
I saw like a study the other day that like your risk of being reduced by like 30 to 60% by petting a dog. Doesn't even have to be your own.
That brings tears to my eyes.
I
'Cause
know.
feel like that's for sure true.
What?
Yeah.
Yeah. NPR posted it. So, I mean,
Yeah.
it's got to be some validity
for sure,
behind
for
it
sure.
somehow. So, yeah, definitely some dog time. I work out a lot. So, I'm really into like infrared sauna, cold plunge recently, and like a little fitness tracker. And it's interesting to see how it impacts like my HRV.
Mm-hmm.
So, like, that definitely is something that I do to like pour into my cup and making sure like if I'm going to work hard in the gym and if I'm going to work hard at work, like to recover just as hard. So
Mhm.
yes, it sucks to like sit in a hot, sweaty red box for 30 minutes, but I can tell I feel better afterwards. And then you can like preach.
Yeah. And one of our things, like you just said, is if you're performing hard, and that could be even just at work running all these meetings, but I don't care whether you're a professional athlete or what that may be, even if you're just walking your dog and you're writing a book, whatever it is, but like you performing hard, you got to recover hard.
For sure. And I feel like that's the one thing is I enjoy working out so much and I enjoy my job so much and I never want the two to impact each other. I
Mhm.
never want to work out hard where I can't come in and be 100%.
Mm-hmm.
And I never want to be so completely depleted from work that I can't enjoy going outside too.
Mm-hmm.
And I want to be fully present or
Mhm.
whatever I do. So
Mhm.
that's definitely been on like my radar recently. And then eating good food.
Mm-hmm. Yeah. But what's your favorite health food?
Mm. We've been on a really big Greek bowl kick
Oh, good.
recently. Like some grilled chicken and like little cucumber feta, like tzatziki sauce. Like that's like our big recently.
No, I'm starving.
Yeah. Easy to meal prep, to
Yeah.
make in bulk, and it's always like good. And it feels like, I don't know, it feels like it's a treat.
Yeah.
Even though it's like all good, healthy stuff, feels like it's very like
And easy. That's the best thing.
Yeah. Yeah.
As you all know, I hate cooking, but I mean, I would eat that or try to throw it together.
It's real easy. We get pita bread, like a little hole in the wall place.
It's probably fresh and good.
So, yeah, it's great. And so we'll do that as like little treat side.
Yeah.
Like, oh look, we're like quote unquote eating out.
I love it.
So that between that and then you just have to grill the chicken and bacon rice. Like
She says it like it's so easy.
I've burned many a scrambled eggs. Like I can like throw down with the best of them in the kitchen, but if you ask me to scramble an egg, I will burn every single
Ooh.
time.
That is a big mistake. Scrambled eggs. They're overcooked.
Oh, yeah. And
Yeah.
my sweet husband has not said a word. And then like 6 months ago, he's like, "Hey, you burned scrambled eggs." And I'm like, "I do." Yeah, I'm like you've been eating burned scrambled
That
eggs.
just shows
for
you how long.
years."
Yeah.
Oopsie. That's what I would say.
Oopsie.
Oopsie.
Oh my gosh. I love it. Now, this episode was super informative and packed. We would love if you would share it with some friends and family who you think need to hear some of these answers to these questions or just want to know more about chiropractic or the different things out there. We would love to answer any more of your questions in part 2. So once again, if you're interested in having us as part of your team, we would love to be on your squad or team or whatever you want to call it, whatever kind of sport we're playing, and even just the game of life. You can drop down to the comments and click the link and schedule a virtual appointment. But we hope you all have a wonderful day and breathe in your butthole. Any last words, Dr. Maddie?
Thanks for having me on. It's been fun.